To locate your pelvic floor muscle, what I would like you to do first is to squeeze the back part of the muscle around your back passage and squeeze like you're trying to stop wind. Then I would like you to focus on the front part of the muscle. So imagine you're trying to lift your testicles or to try and stop a wee. Ideally, we would ask you to squeeze both the back and front part at the same time. That is how you squeeze your pelvic floor. You can check for yourself if you're doing these correctly at home by standing in front of a mirror with nothing on, and as you squeeze your pelvic floor muscles, you should see your scrotum lift and your penis retract slightly. Squeeze and lift for a count of 10 seconds, or whatever you can manage, and work towards that 10 seconds. That 10-second hold, I would like you to do 10 times in a row, and doing that 3 times a day. Those are the long holds. I would also like you to do the short squeezes, where you squeeze and release, squeeze and release. Doing that 10 times in a row, again 3 times a day. Make sure when you're doing these exercises that you're not holding your breath or pulling in your tummy or squeezing your thighs or your buttocks. Everything else should remain relaxed. We would like you to do these exercises in different positions. They don't all need to be done on the floor. You can do them sitting and indeed in standing. You can also try them whilst you're walking if you can. This may be harder in the early stages after surgery if your muscles are very weak. Another element of the pelvic floor training is practicing what we call the knack. This is the ability of the pelvic floor muscle to kick in just before those sudden movements that could cause leaking. For example, coughing, sneezing, lifting, bending. You may have to retrain this reflex. So for example, you're about to cough, so you would squeeze and lift the pelvic floor muscle just before, you'd cough and then let go after. Or when bending down to tie your shoelaces, getting in and out of the car. If you can get into the habit of practicing this now, prior to the surgery, you'll remember to do it afterwards as well. With regards to general exercise, it is good to get up and do brisk walking after the surgery. This helps to increase the blood flow to the area, aid healing and strengthen the muscles. Gently build up to your usual exercise level. Try to avoid too much heavy lifting or impact exercise, for example running or heavy weights in the early stages, particularly if you are still leaking. Wait until you're dry, which indicates that the muscles have recovered. We would recommend you avoid cycling for a few months after the surgery. This is because of the pressure on the perineum on the saddle, which can reduce the blood flow and slow the healing. So starting the exercises now, prior to the surgery, and then as soon as you have the catheter out, these will help you to regain bladder control and reduce incontinence, and also help to restore erectile function.